commonly known as hemorrhoids, are a prevalent medical condition that affects millions of individuals worldwide. Characterized by swollen and inflamed blood vessels in the anal and rectal area, piles can cause discomfort, pain, and bleeding. So, in this video, we will discuss the causes, diagnosis, and treatment options for piles, aiming to provide a comprehensive understanding of this condition. So, let's start. Causes of piles. Piles are primarily caused by increased pressure on the blood vessels in the rectal and anal area. This pressure can result from various factors, including 1. Straining during bowel movements. Consistently straining while passing stool, often due to constipation or hard stools, can lead to increased pressure on the blood vessels in the rectal region. 2. Chronic diarrhea. Frequent episodes of diarrhea can irritate the anal area and cause inflammation of blood vessels. 3. Sedentary lifestyle. A lack of physical activity and prolonged sitting can contribute to poor blood circulation, which may lead to the development of piles. 4. Obesity. Excess body weight can increase pressure on the blood vessels in the pelvic region, contributing to the formation of piles. 5. Pregnancy. The growing uterus during pregnancy can exert pressure on the pelvic blood vessels, leading to the development of piles. 6. Age. As people age, the tissues supporting the blood vessels in the anal and rectal area may weaken, making them more susceptible to swelling and inflammation. 7. Genetics. A family history of piles might increase an individual's risk of developing the condition. 8. Lifting heavy objects. Engaging in activities that involve heavy lifting can strain the pelvic area and contribute to the development of piles. Diagnosis of piles. Diagnosing piles typically involves a combination of medical history assessment, physical examination, and sometimes additional tests. The process generally includes medical history. The healthcare provider will inquire about the patient's symptoms, duration of discomfort, and any relevant medical history. Physical examination. A visual and physical examination of the anal and rectal area will be performed to assess the extent of swelling, inflammation, and any visible piles. Digital rectal examination. In this procedure, a gloved finger is inserted into the rectum to check for abnormalities, such as internal piles. Anoscopy or proctoscopy. These procedures involve the insertion of a thin, flexible tube with a camera, anoscope or proctoscope, into the anus to view the inside of the rectum and anal canal more closely. Sigmoidoscopy or colonoscopy. In cases where internal bleeding is suspected, a sigmoidoscopy or colonoscopy may be recommended to examine the lower part of the colon and rectum in detail. Treatment options for piles. The treatment of piles depends on the severity of the condition and the symptoms experienced. Various conservative and medical interventions are available. 1. Lifestyle modifications. Making changes in diet and daily habits can help prevent and manage piles. Increasing dietary fiber intake through fruits, vegetables, whole grains, and drinking plenty of water can soften stools and ease bowel movements, reducing the risk of straining. Regular exercise can also improve blood circulation and prevent constipation. 2. Topical treatments. Over-the-counter creams, ointments, and suppositories containing hydrocortisone or witch hazel can provide temporary relief from itching, pain, and inflammation associated with piles. 3. Sitz baths. Soaking the anal area in warm water, sitz bath, for 10 to 15 minutes several times a day can alleviate discomfort and promote healing. 4. Medications. In cases of persistent pain and inflammation, oral pain relievers such as acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, may be recommended by a healthcare professional. 5. Rubber band ligation. This minimally invasive procedure involves placing a rubber band around the base of an internal pile, cutting off its blood supply. The pile eventually shrinks and falls off within a few days. 6. Sclerotherapy. In this procedure, a chemical solution is injected into the blood vessels of the pile, causing it to shrink and wither away. 7. Infrared coagulation. This technique uses infrared light to coagulate the blood vessels supplying the pile, leading to its shrinkage and eventual disappearance. Hemorrhoidectomy. Surgical removal of piles is recommended for severe cases or when other treatments have failed to provide relief. This procedure is typically performed under general or regional anesthesia. Prevention of piles. Preventing the development of piles or reducing their recurrence involves adopting healthy lifestyle habits. High-fiber diet. Consuming a diet rich in fiber promotes regular bowel movements and prevents constipation. Fiber can be obtained from whole grains, fruits, vegetables, and legumes. Hydration. Drinking an adequate amount of water throughout the day helps maintain soft stools, making bowel movements easier. Regular exercise. Engaging in regular physical activity improves blood circulation, reduces the risk of constipation, and helps maintain a healthy body weight. Avoid straining. Refrain from straining during bowel movements. If a bowel movement is difficult, try using a stool softener temporarily. Prompt bathroom habits. Avoid delaying bowel movements and respond promptly to the urge to have a bowel movement. Conclusion. By adopting a healthy lifestyle, seeking medical advice when necessary, and considering the appropriate treatment options, individuals can manage piles and improve their quality of life. If you like my video, then subscribe to my channel. Thanks for watching my video.